Have you ever walked into a doctor's office and just gotten a feeling? You know, that sense that you're being sized up before you even say a word? Well, you're not imagining things. You absolutely are. Today, we're going to pull back the curtain on that secret initial health assessment, all the information a healthcare provider gathers in just those first few seconds. So how on earth do they do it? Let's dive in.
It's a fascinating question, isn't it? And the answer is a whole lot. Long before the stethoscope ever comes out, long before the blood pressure cuff even gets inflated, a really powerful diagnostic process has already kicked off, and it's all based on simple, careful observation.
You know, this powerful first impression isn't just a hunch or some kind of intuition. It's a real clinical skill, and it has a name, the general survey. You can think of it as the foundation, the very first building block for the entire physical exam that follows.
So this isn't just a casual how do you do. The general survey is a deliberate, focused study of you as a whole person. It's about getting a quick read on your overall health and picking up on any obvious physical cues. And the key thing? It starts literally the second you walk through that door.
So what exactly are they looking for in this split-second assessment? Well, your body is constantly telling a story, and a trained clinician is an expert at reading those opening lines. Let's start to decode the first chapter of your body's story.
That first glance is broken down into 4 key areas. They're noticing your physical appearance and hygiene. They're looking at your body structure and how you hold yourself, your posture. They're observing your mobility and your gait, how you walk, and they're even getting a feel for your emotional and mental status. Each one of these offers a crucial piece of the puzzle. Now, here's a simple question with some pretty profound implications. Do you look like your age? It sounds basic, right? But looking older than your years can be a quiet signal of chronic illness or a really tough lifestyle, while looking younger often points to good health. It's one of the fastest, most holistic indicators a provider has. Okay, so after that initial visual sweep, the assessment gets a bit more quantitative. We're going to move from just observation to actual measurement, focusing on the body's core data points, your vital signs, and that really complex experience of pain.
These 5 vital signs, they give an objective, numerical snapshot of your body's most essential functions. They're like the dashboard lights for your body. Temperature can signal an infection. Your pulse checks your heart's rhythm. Respirations measure how well your lungs are working. Blood pressure, well, that gauges the force on your arteries. And oxygen saturation tells us how much oxygen is getting to your tissues. Together, they create a crucial baseline.
Now, pain, that's a different beast entirely. Unlike your temperature or your pulse, you can't just measure it with a device. It's defined here as an unpleasant sensory and emotional experience, which really highlights how subjective and personal it is. Because of its importance, it's often called the 5th vital sign, but assessing it takes a completely different approach.
So how do you measure something so subjective? Well, clinicians use tools like these. For adults, the numeric scale, from 0, no pain, to 10, the worst pain imaginable, is pretty standard. But for kids, or for anyone who might have trouble communicating, the FACES scale is amazing. It lets them point to a face that shows how they feel, using the universal language of expression.
To get the full story on pain, a clinician basically has to become a detective, and they use a handy mnemonic like OPQRSTU to guide their investigation. O is for onset, when did it start? P is for provoking factors, what makes it better or worse? Q is for quality, is it a sharp pain, or a dull ache, or is it throbbing? Each letter uncovers another clue to build a complete picture of what the patient is going through.
All right, let's shift our focus now to the body's largest organ, the skin. Along with our hair and nails, this whole system is like a giant dynamic billboard for our internal health. It offers this rich, incredible tapestry of clues.
Your skin's color is a palette that can say a lot about your health. For example, pallor, which is a paleness or loss of color, could suggest anemia or poor blood flow. Erythema, that's that telltale redness, points toward inflammation or maybe a fever. And jaundice, that yellowish tint to the skin and eyes, is a classic sign of liver trouble. Every shade tells a part of the story.
You know, the life cycle of a bruise is this absolutely fascinating chemical calendar. That initial red-blue color, that's from oxygen-rich hemoglobin. As it loses oxygen, it turns blue or purple. But then the real transformation begins. The body breaks that hemoglobin down into a green pigment called biliverdin, which then converts into yellow bilirubin, before it all finally fades to brown. It's like forensic science happening right on your skin.
When a clinician sees a lesion on the skin, they first classify it.
A primary lesion is the thing that showed up first. Think of a blister, which is technically called a vesicle. A secondary lesion is what happens to that primary lesion over time. So if that blister pops and then dries out, it becomes a crust. Understanding this difference is key to figuring out the root cause of a skin condition.
And it's not just your skin. Believe it or not, your hair has stories to tell too. If it's dull, coarse, and brittle, that might suggest a nutritional deficiency or an underactive thyroid. On the flip side, unusually fine hair can be a sign of an overactive thyroid. And get this, even hair loss on your legs can be a clue, sometimes pointing to poor circulation.
So, we've looked at all these individual clues, from posture to pain to skin color. The final step in this whole initial assessment is putting all of those puzzle pieces together to see the full, comprehensive picture of a person's health.
And this is really where it all comes together. A clinician isn't just seeing thinning eyebrows in isolation. They're connecting that to other signs that might point to hypothyroidism. A drooping eyelid, known as plosis, isn't just a facial quirk. It could be a red flag for a neurological issue. Every single tiny observation becomes a data point, and when you combine them, they start to form a potential diagnosis.
So, the next time you walk into a clinic, you'll know that the assessment has already begun. All these subtle clues are constantly communicating your state of health. It leaves you with one final thought to ponder. What story is your body telling at this very moment?